So let's begin by asking some questions. And you're welcome to raise your hand if you agree with the following statements. Who here thinks that Canada's opioid crisis started when the COVID 19 pandemic started? Raise your hands. Okay. Who here thinks Canada's opioid crisis started 10 years ago? 20 years ago? How about over 30 years ago? Okay. The truth is that Canada's opioid crisis started 40 years ago in the 1980s when there was an increase in drug prescriptions across the board. And let me put this into context for you a bit more because 40 years is a really long time. We humans have achieved a lot in the past 40 years. In fact, humanity in the last 40 years is able to connect everybody around the globe onto a single platform in the 1990s using what's called the World Wide Web. Humanity in 2010 created artificial life by replicating an artificial cell. But let me remind you, just this year in 2022, we were able to cheat death when we reversed the cell death of a pig. So in the last 40 years, we've done a lot. We've connected everyone, all 7 billion people around the world. We created artificial life and we cheated death. Yet, what bothers me so much is that why haven't we solved Canada's opioid crisis amidst all of these amazing advancements and achievements? Well, the bigger question I should be asking is, what have Canada been doing wrong in the last 40 years? Today, Canada is known as one of the highest consumers of opioids in the world. Mortality rate has been on the rise for the last few decades. From January 2016 to March 2021, an estimated of 23,000 Canadians died due to the opioid crisis. In 2020 alone, an estimated of 4,395 people died due to opioid-related overdose. And to put that into simple terms for you, that's approximately 12 opioid-related deaths per day. So the purpose of my talk today is to convince you that Canada's current approach to the opioid epidemic is wrong, and there are other more concrete methods and effective methods out there in the world that Canada can be inspired from. And by doing so, I'll discuss the causes, effects, as well as the promising solutions that exist for the future of this issue. According to the Canadian Centre on Substance Use and Addiction, the causes of the opioid epidemic is due to a various of complex reasons, but notably 3: illegal contaminated drug supply, prescription drugs, and opioid tolerance and dependence. So, firstly, illegal drug supply that is not obtained directly from doctor prescription is increasingly contaminated with something called fentanyl, which is a synthetic opioid. And to put that into context for you, you cannot see, you cannot taste, you cannot even smell fentanyl. But a few grains of fentanyl is just enough to kill you. According to a report from the Parliament of Canada, in 2020 alone, there are 3.5 times more fentanyl-related overdose than there are of non-fentanyl-related overdose. So therefore, we can conclude that fentanyl is the #1 killer in Canada's opioid crisis. Secondly, even though medically prescribed opioids can help patients in the short term, long-term use of opioids can lead to increased exposure to them and their potential risks. Finally, long-term use of opioids can lead to tolerance, meaning higher or more frequent doses are actually needed to achieve the same effects. This causes the body to be more dependent, and withdrawal will be fatal. However, these root causes of the opioid epidemic are often ignored, overlooked, due to the amount of stigma, the amount of stereotypes, and the amount of fear in our society today. And I want to be very, very honest with everyone here, because I think that a majority of people in our society does not want to lay an eye on somebody who uses opioids, does not want to witness the suffering, and does not want to help because it's not their problem. The current Canadian system of dealing with the opioid addicts is to lock them away from society, put them within the legal system. And the result is that these people come back into the society with shame, with a criminal record, and to a world that doesn't accept them. We're not willing to offer enough treatments, enough opportunities, enough acceptance for these people. So this now leads me to ask perhaps the most important question in my talk today. What can we do to solve this problem? I want to draw your attention towards the Portuguese model of dealing with the opioid crisis. Because Portugal in the 1990s was in the midst of an opioid crisis so intense that Lisbon was known as the heroin capital of Europe. However, this all changed in 2001 when Portugal implemented a model based on humanism. And according to a Washington Post article, hardly anyone now dies of an overdose in Portugal. The Portuguese model sees drug addiction not as a crime, but as an illness. In Portugal, users of opioids and drugs who are caught by the police go before a local 3-person panel for the dissuasion of drug addiction. The panel usually consists of a lawyer and other medical professionals help create a fully personalized treatment plan for that individual. The country has also taken steps to decriminalize all public, private use, acquisition, and possession of all drugs. And instead of taking money to combat drug addicts, they have taken that money to fund an abundance of safe injection sites, counseling services, and job programs. So, for example, let's imagine if I am a drug addict and I used to be an accountant. When I am ready, I can go to an office and the government will say for me, if you employ this guy as an accountant for a year, we'll pay for half of his wages. And the goal here was to make sure that every drug addict in Portugal has another opportunity in life. This mechanism of treatment emphasizes harm reduction. And by doing so, a victim of the opioid crisis is not placed within a judicial intervention, but rather a healthcare intervention. The benefits to this model are evident. According to a New York Times analysis, the number of heroin users in Portugal, which was 100,000 before the model, dropped about to just 25,000 today. Portugal now has the lowest drug-related death rate in Western Europe, with a mortality rate a 10th of Britain's and a 50th of the United States. I'm sure that the Portuguese model of dealing with the opioid crisis, a model of forgiveness, of inclusion, and of acceptance, can help Canada as well in the opioid epidemic. However, I don't think that's enough, because none of these changes can happen if we don't change our perception, our mindset towards people who uses drugs. And I want to leave a message today which I think captures this need for a shift in perception. And this is a quote by Dr. Gabor Mate, a Canadian physician and an expert in addiction. Addiction is not a choice that anybody makes. It's not a moral failure. It's not an ethical lapse. It's not a weakness of character. It's not a failure of will, which is how our society depicts addiction. What it actually is, it's a response to human suffering. Looking back, 40 years. 40 years is how long Canada has been dealing with the opioid crisis. For an individual, 40 years is half of their lifetime ruined by the opioid crisis. For a country, 40 years is a whole generation harmed by the opioid crisis. I believe that the first step to change is for people to believe that change is possible. So as Canadians today, let's open our eyes to the new solutions out there in the world. Let's believe in these new solutions. And let us, most importantly, solve the opioid epidemic in this generation in order to protect the next. Thank you.